big truck goes by midway through, that thing's going down.
I know. I feel like this one almost
Yeah, that's what they
bigger
told
than
us.
this long.
They-
The Jenga game.
I don't see anyone.
Oh, Jenga's good.
So
I
you just-
could bring Jenga.
Right. Stack it up.
Yep. Did the audio from the mic?
Yeah. I just noticed this on the camera because I've never seen it before. One of the ski cars was showing his WP. Oh, yeah, okay. Because I don't want to only have one.
Is this up? Yeah.
Okay, thank you. That should. Yeah.
Well, I picked up. So this, no, I know that. It's just this camera has it kind of built into it.
We're giving that 2 minute warning.
Good afternoon. My name is Frank Haney, Winnebago County Board Chairman. I am joined by Rockford Mayor Tom McNamara and Winnebago County Public Health Administrator Dr. Sandra Martell. In the state of Illinois, we heard from the governor about an hour ago, we have 1,285 confirmed cases of COVID-19 in our state. We do anticipate that number increasing in the coming weeks, just as we do locally. This is why continued efforts around flattening the curve are so important. And to that end, about 5 months ago, the City of Rockford and Winnebago County entered into a partnership around emergency management that, looking back now, I think might be one of the most important partnerships that we've worked on in my time as chairman. And it really brought together under one umbrella our emergency management services. And it was the idea of Sheriff Gary Caruana and Rockford Fire Chief Derek Bergston with the recommendation of Mayor McNamara and myself. And I look back now at how important it is that we work together across government entities as a region with all of our partners as we face this challenge. On March 12th, the Emergency Operations Center was officially opened in response to COVID-19. Including in the Emergency Operations Center is Incident Command, Operations, Logistics, Finance, Planning, Safety, the Joint Information Center, and the Winnebago County Health Department Call Center. The mayor, the Public Health Administrator, Dr. Martell, and myself continue to meet via conference call daily with the heads of our hospitals and the leaders inside the EOC, the Emergency Operations Center. My confidence about our community's ability to take on this challenge comes from the preparation that group and the hard work that they are doing and the expertise that has been brought together as one team. As cases increase, and they will, our capacity with our healthcare apparatus is being looked at and monitored on a daily basis. Contingency planning, including scaling up for additional capacity, if needed, is things that are being talked about on a regular basis. The governor called over the weekend for healthcare workers who are retired to continue or consider coming back to work. The work of our hospitals has not gone unnoticed. They have been planning around COVID-19 for weeks. They have recently canceled non-essential procedures to create capacity in their respective facilities. They are limiting or eliminating visitors. They are willing to collaborate with each other, share resources across the 3 hospitals, share ideas, and solve problems together. Few communities or counties are as blessed as we are to have 3 world-class hospitals working together at this level. PPE, or personal protective equipment, is an issue at every level of government, as we know. We're hearing it at the federal, state, and local level. The Emergency Operations Logistics team recently placed a large order through the County Purchasing Department. The county is also working through one of its vendors to secure additional PPE. Hospitals have been working, our local hospitals have been working hard in their respective networks to secure additional equipment as well. Over the weekend, the Rockford Area Economic Development Council put out a call to the private sector around the following items: isolation gowns, procedure masks, exam gloves, lens covers, eye protection, and germicidal disposable wipes. Locally, we have businesses stepping up. At the state level, we have businesses coming together around PPE, and we've heard some good news around movement at the national level with the private sector as well. The character of our community is not built by challenging times. The character of our community is revealed by challenging times. It is revealed in many ways, both big and small. It is the grocery store shopper saying thank you to the cashier who is working to feed our community. It is recommitting to strict adherence to social distancing to protect frontline grocery workers, frontline healthcare workers, and our first responders. It means that when you go to the grocery store, that if the line is long or the lot is full, that you turn around and go home. That is how we reveal what we're really about as a community. That is showing commitment to flattening the curve and doing everything we can to keep our families and our community safe. It is the pastor helping his congregants stay connected to their faith by creating a drive-through confession. It is the nurse who reassures the patient and the parent who helps explain what's going on to their child. The key to success at the citizen level is how seriously we take this when no one is looking. No one can do everything, but we all can do something and have a responsibility to do it. I believe that in the final analysis, the character of this community will carry us through. There are 5 things every citizen can do for yourself and others in the next few weeks. Number 1, consider giving blood at the Rock River Blood Center. Call 815-965-8751 for an appointment. Number 2, you want to feel better? Be kind. Be kind to the people you're engaging when you do go to the grocery store, when you do go get that and fill up your tank of gas. Say thank you often. Adhere to the idea of staying home at every turn and social distancing. Connect with friends and family and reconnect with your faith. Take regular breaks from the news and social media. On a side note, my wife actually took the phone away from me last night and made me watch TV, watch a movie as a family. I also want to take a minute and address the need for continued united leadership around COVID-19 locally and beyond. Democrat and Republican spats. There is a time to fight on a principle, and there's a time to find middle ground. I think the time to find middle ground is right now in Congress, and we need them to pass the federal aid package ASAP to help our families, to help our businesses locally. I look at it this way, it's a sports analogy. On the front of our jersey, it says Rockford Region. It says Winnebago County. Maybe on the back of our jersey, it might say City of Rockford, Winnebago County Government. It may say Rockford Fire. It may say Mercy Hospital. It may say Swedes or OSF. But right now, the focus is on playing for what's on the front of the jersey and making sure we're doing everything we can together to produce the best results. That's how we flatten the curve. The name on the front of the jersey right now is the most important thing. We talked last week, and I just want to reiterate it. I'm sure Mayor McNamara will talk about it because he often has, is this idea that we do not, during the time of a pandemic, want to have an infodemic. Make sure you are getting your information from reliable sources. And again, I want to thank our media partners, not to be redundant, for scrutinizing the information that they are passing out to the community. You have been key and important partners in this process. The information flowing from the city and the county, in particular the health department, in particular IDPH at the state level and the CDC at the national level, is where we are getting a lot of our professional health information, and that's where you should as well. Lastly, almost lastly, is this idea we continue to see young people affected by COVID-19. I believe I saw on the news that a baby through a 99-year-old have been affected with COVID-19 if you look across our country. More locally, we've seen teenagers, folks in their 20s, 30s, 40s, 50s, and 60s who have been a confirmed case with COVID-19. We need to take it seriously regardless of age. When we come out of this, and we will come out of this, there's going to be a little bit of a new normal. There's going to have to be new discussions about how we approach public health, population health, how we talk about being a healthier community and a more prepared community. It's going to force really tough discussions between government partners on how we all work together better in the future to serve you better. So there is going to be a new normal when we get on the other side of the immediate health challenge, and we will work hard then as we are now, and we will work together. Lastly, I just want to say, as you have questions, whether you're an individual or a business related to COVID-19, specific to Winnebago County, I would encourage you to email covid19@wchd.org. covid19@wchd.org. Thank you very much. I'm going to turn things over to somebody who has done an incredible job every day around this discussion. And behind the scenes, I want you to know when you see your national leaders, Republicans and Democrats, bumping heads over things, they should follow our lead. Mayor McNamara is working absolutely harder than anybody else around fighting for everything for this community, making sure the city's prepared, we're prepared as a community, and I appreciate his leadership and his willingness to not have political discussions during a public health emergency, but to focus on how do we improve health outcomes, how do we pull through this together the best. So I want to turn things over to the mayor, and again, thank him for his leadership.
Thank you, Chairman. Really appreciate, as I've said, I think every press briefing that we've had of this opportunity to work with you so collaboratively. So I hope the majority of the people who are watching this or listening to this are at home, where you should be. Staying at home is absolutely critical right now. This disease is highly contagious. You can easily spread this disease to so many other people without even having symptoms yet. So it's critical that you are staying home. Today, you will learn of new developments in Winnebago County. And I just want to say that my thoughts are with every single individual, every single resident in our county who is fighting this disease. While new cases are spreading a little bit slowly here in Winnebago County, we know that number will increase, as the chairman said, as it's exponentially increasing elsewhere. A couple of things that's really brought this to light to me is in Illinois, if you just look at 1 week ago, we had fewer than 100 cases. Today it's announced that we have more than 1,200 cases. If you look at the United States, just on Wednesday, just a few short days ago, we had 9,400 cases, and today we have more than 35,000 cases. We must remain vigilant. We have to stay at home. We have to practice social distancing. We have to wash our hands and surfaces frequently. But today I also want to tell you an area that I'm really line battling this disease and those who are helping our community in so many other ways. Today, our kids should have returned to school. They should be going back into the classroom today. But those schools are temporarily closed, and so now our community is wondering, how do we feed those children? Many of our children in the city of Rockford are getting their breakfast and their lunch through the school district. And thanks to teachers, employees, and nutrition staff at Rockford Public Schools, District 205, for working together to provide prepackaged breakfast and lunch to children in our community. They began handing out food today at 4 different locations. Big thank you also to the Community Action Agency of Winnebago and Boone Counties and the YMCA of the Rock River Valley, Rockford Housing Authority, the Rockford Park District, and Life These organizations are delivering food and meals for kids at several of our housing developments and community centers beginning this Wednesday. And I would urge all of you, you can find out more information about these initiatives at the City of Rockford's website as well as our social media accounts. So I want to transition a little bit and talk to you about businesses in our community. Our businesses are the backbone of our city. Most of our businesses, and by and large, truly, most of our businesses are taking this pandemic seriously. But unfortunately, some of them are not. We have been inundated with phone calls and emails from employers and employees asking if they are essential. As someone who's worked in the private sector before becoming mayor, I certainly understand the stresses and the pressures that small businesses are under with this pandemic and the stay-at-home order that the governor executed on Friday, and it began on Saturday. These stresses and pressures put tremendous strain on your business. We all, though, have a responsibility to flatten the curve, save lives, and saving lives will lead to a more speedy economic recovery. Business owners have a responsibility to objectively analyze if they are truly essential. And if they are, they should stay open. But they must take necessary measures to protect their employees and their customers. And if you are not essential, so over the last 48 hours, the opportunity to speak to the governor. We've spoken to both Senator Duckworth and Durbin. I have been on phone calls with literally more than 400 mayors over the last 48 hours. Every single person is saying the same thing. Our state is in dire need. Your gloves, your gowns, things of that nature. I ask right now, if you are a non-hospital medical provider, essential goods in order to take advantage of this crisis. And if you have a complaint, selfish. You are putting yourself, your family, your neighbors, and your fellow Rockfordians at risk. And I'll repeat what I said on Friday. This is a historic moment for our great city.
ours. For the fourth day in a row, Winnebago County is reporting another positive COVID-19 case. The case is a Winnebago County resident in their teens. This case brings the total number of cases in the county to 6 positive COVID-19 cases. Similar to the state, we expect that we will continue to have positive cases in our community, which is why the social distancing and the messages regarding the governor's executive order number 10 are so important. This is the tool that we have right now. We don't have a vaccine. We don't have medication to treat. So we need individuals to take the messaging seriously. Stay put. Stay home as much as possible. You've heard both the mayor and the chairman talk about the importance of this. And again, we cannot reiterate enough. It stops the virus from traveling around the community. Now, if you need to go out for essential items like food, medicine, a medical appointment, those are essential services, and you can certainly move throughout that. But minimize the amount of travel that you're taking out. Stay apart. I heard today the governor started to use a little bit physical distancing versus social distancing. When you have to go out, maintain that 6 feet of distancing, whether it's at the grocery store line, whether it's at the gas station to the attendant. It's making sure that you're helping protect the individuals who are delivering those essential services. It is not just for the healthcare worker environment. Stay connected. We've talked about this numerous times, and really the importance of making sure that you're getting factual information. We spend a lot of time tracking down fake information or false information, because if we believe that there is something going on, we need to investigate it. We talk about how our disease investigators, when there's a positive case, have to go out and interview that particular case for all of the contacts they may have had, and then outreach to those contacts to give them direction and determine the best course of action. Stay healthy. For doing all this, our goal is to stay healthy. If we stay put, if we stay apart, stay connected, we have an opportunity to stay healthy. So again, we reiterate the importance of our community. These actions, one case each day, but we expected cases to increase. But it's important that our community come together and understand how important this is our tool that we have right now. Without vaccine and without a medication, our hospital systems are prepared to take care of the sick, but we need people to stay as healthy as possible. So thank you. And I am happy to answer questions. I know I'm the person that gives out the numbers, and so we can go through that. From over the weekend, right now we have a total of tests being administered of 288. That includes both what we call the persons under investigation category. Those are approved through the Illinois Department of Public Health, and the what we call the IDPH, the private lab testing. I apologize for that. We have a total positive of 6 cases, 3 in what we call the IDPH, or persons under investigation category, and 3 that were coming out of the private sector lab testing. Total negative to date are 132, but we have a total pending specimens waiting for results of 150. So again, it's important to understand that every day we get a different, we test out more people, that number increases, and we remain on duty 24/7 when those results come back to us, begin outreach. So that work that occurs over the background, as you know, we stayed connected over the weekend, so we could then also take a look at what was happening, so that we could then respond as quickly as possible as we begin this process of really trying to, as we said, flatten that curve. If we can stop the number of cases increasing, that is our goal. So any other questions that I can answer or respond to?
Dr. McCall, can you talk to us about, you say our hospitals are prepared. What kind of predictive modeling are you doing right now in terms of can you tell us where we might be at in terms of infected people needing hospitalization or home quarantine a week from now, 2 weeks from now?
Right. So we use a lot of national modeling. We look at the number of cases that are increasing. We also look at what's been going on in other nations. So obviously we've looked at the ventilator need, what kinds of people might need hospital care, might need to stay at home. So all of that is going on right now. So as hospitals have begun, you heard that they were stopping elective procedures. They had begun that process of ramping those down, really with 2 kind of mindsets. One, to conserve the personal protective equipment, right? The other part was to really begin, how could they reconfigure and retool their systems to begin to take care of more sick individuals. In addition, the goal of some of this, as we talk about this staying put, I think people kind of minimize that concept of staying home. The reason is that we know that many people could be cared safely for in their own home if they don't expose other individuals. So the most vulnerables would need hospital care. So it really becomes that important part of, if sick, staying home, contacting your physician or provider before you're going in, so that the hospitals are beginning their ramp-up procedures to, again, get their setups and their units, making sure that their staff are trained, making sure that they replace out, and everything is ready to go to begin to receive those individuals at highest risk.
Is there a reason the hospitals are not here? I think on the first day we started having these press conferences, there were representatives from all three. Certainly they could answer these questions in terms of the census, the bed count, the capacity. Have they been invited?
They are working through the Emergency Operations Center. Right now, as you would know, that they are really working through all of that, and we want them to be doing that. As you transition from any business, like every business in our communities have been somewhat disrupted, the healthcare industry has been disrupted, right? Typically, they're doing, well visits, they're doing preventive care, they're doing what we would consider non-essential surgical procedures. Sometimes they're called elective procedures, but these are the kinds of things. So they're really having to retool their system and begin that rescheduling process. We meet with them every day about what needs they have in terms of personal protective equipment, what they're seeing. We do also what we call surveillance of the emergency department data. We call it Essence. It comes out in our flu report as well, as we look at what are the ED visits looking like, if they're ramping up, so that they can begin that process really of spending their time and attention and their valuable resource to planning for this response.
So specifically, how many beds do we have in each of our hospitals? Regular beds, ICU beds, and how many are we going to need a week?
Well, we begin that process of identifying through it. So we do not have a number to report out today, but they do track those on a daily basis, and what their census is for the different types of beds.
So we know that there's a shortage of PPE right now. What about testing? Are there enough tests right now, or are we still seeing a shortage in that as well?
We continue, as the national picture is identified, testing continues to be one of the questions that's out there. We continue to be able to submit tests through both our private labs, and those are really being used for individuals that do not meet what we call the persons under investigation criteria, which is being reserved for individuals who are hospitalized with symptoms of atypical pneumonia, and those from congregate settings. We talked about that last week. Those are being prioritized so that we can stop an outbreak in a potential congregate setting. Both systems seem to be turning out lab test results now in a shorter time frame, both the private lab as well as the IDPH lab. So we put those in there, we monitor, and remember, we are getting those reports from the hospitals of the private labs. They're submitting those voluntarily to us so that we get an sense and idea. So that number is out there. We heard today about the federal ramp-up of the testing sites. We are learning more about that. We have agreed and committed to, if they want to place one in our region, to step that up as well.
Will this community do drive-through testing? A number of communities I'm reading across the country are doing that. Is that something that we're asking for or plan to do?
That was kind of the discussion about the federal response. The testing that's being ramped up now, when you hear about it being in Bolingbrook, North Lake, and I forget the last community. Those are being ramped up by the federal response. And again, they're being reserved for healthcare workers, we understand at this point, and first responders. We have indicated that we would, from a regional approach, we don't want to take our first responders and healthcare workers off a front line to go and get tested outside of our community, out the area. So several of us in the state have said we would ramp up a response in our area. But again, when you talk about total number of tests, they're really reserving them for identifying those that are symptomatic, those that we need to make sure that are not in potential congregate settings that might spread it to others.
Speaking of testing, you mentioned the qualifications. Did this new case with the teenager, did him or her, what criteria did they meet to be tested?
We've talked about that before. They met one of the three criteria. It could have been a travel, it could have been a hospitalization. We are not releasing those personal details.
Okay, another question related to testing. I know this one can be a bit complicated, but a scenario is kind of across that if potentially someone who's in an assisted living or a nursing home facility gets an upper respiratory, starts showing those symptoms, but are not, perhaps they're not tested, and then they were to pass away before they get tested, would it be possible to then test them post-mortem by chance?
Yes.
Have any of those tests been conducted in the area?
I believe we've had one.
Okay.
And again, what we would do in that case scenario, all of our skilled facilities, congregate living situations, they notify us that they have an issue, that we begin to bring that person into the healthcare setting with notification that we have someone from a congregate setting coming in so that they can determine and evaluate the testing. We also look to see what's the pattern of disease activity in that particular setting. Is there anyone else? You know, what's been the temperature readings on their healthcare workers? What's been their absenteeism rate? Because they're having to track all of that, because our goal will be really to make sure that we can mitigate as quickly as possible an outbreak in a congregate setting where it could spread very quickly.
Do we have any idea, you mentioned one specific test in that, do we have any idea when that result might come back?
It's already come through the queue.
So it's come through negative?
We only report on positives, and we've reported on every individual so far. All of our cases at this time have not expired.
Can you talk about the Emergency Operations Center, who's in charge, and how our 3 hospitals are coordinated to assist? When you meet every morning at the Justice Center, who's around that table?
It depends on the day, but yeah, the question is around the Emergency Operations Center, and Mallory Wren is coordinating day-to-day activities. The fire chief, Derek Bergston, is heavily involved. And then they have a number of folks from around the community. The Sheriff's Department will have folks participating. A number of other entities. Rockford Fire Department is very engaged in the process as well. So it depends. When we're talking logistics, ordering PPE, you will see Ann Johns from our purchasing department get involved with the logistics team. When they're talking about the hospitals may not be physically going to the Emergency Operations Center, but we're all calling in on a daily basis. And to your very good question about why are the hospitals at a press conference like this, we are trying to lead by example. And right now, we are asked to have 10 or less people in meetings such as this, and we're at 10 with the 3 of us up here, 4 from the media and 3 professional staff in the back. We would be very welcoming of the hospitals, of leaders that are doing a lot of the operational work in the Emergency Operations Center. There just isn't room in this room based on the executive order from the governor. In terms of the Emergency Operations Center, the Winnebago County Health Department hotline team, so there's multiple people from the health department working there. Members of the communication team are also stopping in as well. So I guess it depends on the time of the day, but Mallory's doing a great job. And again, that's a reflection of a partnership that was cemented about 4 or 5 months ago between the county and the city. I will be very honest with you, just speaking as a chairman, not as a health professional or medical professional, but it tells me a very serious, it should speak to the community the same way it speaks to me. All 3 hospitals have temporarily halted non-essential procedures. They're doing so to create capacity in their hospitals. That is a very, I think, telling thing that they are anticipating the potential, depending on how successful we flatten the curve. If we are as successful as we want to be, capacity is not going to be something that we are spending a lot of time talking about. If we are not as successful as we would want to be. Again, I'm not speaking as a health professional. I'm not speaking as a PhD. What I will tell you is discussions at every level of government, whether you're watching CNN, you're watching an update from somebody in the governor's office, or you're talking to local folks, that is the strategy, is to flatten the curve. That is why we're asking every citizen to buckle down and stay at home. That's what the science tells us to do to make sure that we can handle when we see an increase in the number of cases. Mayor, did you want to add anything? I don't want to.
No.
Okay.
I want to go back to that question of capacity, though, because I asked it, and I think
Yep.
the answer was, we don't have those numbers available right now. Can we get those numbers about bed capacity now versus where we think we'll be in a week or 2 from now and what we'll need?
They're working on that as we speak, and each of our 3 hospital partners, as well as our FQHCs, have stood up incident command at each one of their locations. So understand that they have a team that's working through all of those pieces that they need to take a look at. How do they want to do, how are they looking at it? How are other regions throughout the country, as well as the state of Illinois? Because while we talk about our region, we're also part of a state, right? And we also have partners across our state lines. So to your point, it's really understanding about figuring out how do they, going to manage that, what's it going to look like, how are they going to, the concept of, I come back to, and I'm going to take a simple one, the idea of private rooms. When you have a pandemic, that concept, you really retool your rooms so that you're not doing, because you're going to have to be able to exercise as much of, and really leverage the staff that you have available to work that. So every single one of them is looking at what is it going to take to maximize the amount of people that they can manage and care for in those systems, as well as what level of care, right? Because we have different levels in our institutions as well as what they can provide. So that really becomes something that they are actively working on, and they kind of began that work, I'm going to say, months ago, but they also really started ramping it up. So a while ago, you heard about they were doing a lot of testing coming out of the emergency departments. They are really now refocused on serving individuals with symptoms that require hospitalization, which is what they should, and then really kind of getting that out into the other sector. So
to make sure that I'm understanding you, they're working on those numbers, and right now, as we speak, they don't know.
they have numbers of what their current beds are, but as they begin to plan and revamp about how they're going to do that, they're giving, really working to plan for the maximum capacity they can.
So thinking beyond that maximum capacity, some cities, New York City comes to mind, converting this convention center into a makeshift hospital or a desire to do so. Do we have plans to do that type of thing in this community, using perhaps some of the dormitories at Rockford University or Rockford Christian or other?
All options are on the table. First of all, we have emergency housing, right? Because, again, when you start talking about a Rockford University, that would be appropriate for some levels of care, but not people that required intensive care. They would have to take a look at different kind of management of that, what the powertrain is, what the oxygen, when you start looking at what's required to provide intensive care. They are the experts in that field. They also have emergency operations plan. Then they also work from a regional through the Illinois Hospital Association to begin to say what mobile units can come out and what's available. So again, when you start talking about that, there are plans and works at every single level of converting for every level of care. And there is also a lot of discussion about, as you know, alternate housing for individuals. We know that we have a significant homeless population that's cared for in a congregate setting. If we have an outbreak or a case in a congregate setting like that, how can we quickly pre-position them? And the Emergency Operations Center has looked at plans and has looked at all the locations that are available to us for that purpose.
Is there any specific direction that the EOC has given to our homeless shelters?
Oh, yes, they receive the same guidance and direction as a skilled nursing facility. We're treating them as the same. So their staff are monitored. They are, they have to log everyone who comes in and out. They do, I'm going to say, meal distribution in the same way. They've had to modify how they also do the meals, so that we are really trying to put in place the same thing we do for any congregate living situation.
Have you seen in the past couple of days an increase in people in our community needing to get tests?
The number of tests that we did over the weekend, we went up 122 tests from Friday's report. So when you say number of people needing tests, people coming in and being evaluated for tests, that was the number.
Quick question for either Chairman Haney or Chairman McNamara. Specifically, I want to ask about, you mentioned, going about certain businesses, about whether or not they're essential or not essential. When we last spoke to you guys, there was kind of a promise that you guys would be talking over the weekend about what businesses are and are not essential. I think to an extent, I'm asking about enforcement of this because I understand you're kind of reaching out to business owners, sensibilities and trying to stop the virus. But there's also an extent, like you mentioned, a lot of people reaching out to your office, a lot of people reaching out to Chairman Haney's office, a lot of people reaching out to us as media outlets. What's kind of the process of enforcement for this?
So first, as I said last week, had high confidence that our business owners, by and large, would follow this, and that truly has been the case. Before we get to the enforcement aspect, first, we also set up a website. It's COVID-19 at wchd.org. So any individual business owner or employee can submit a question. And so what we're doing internally, because the executive order came out on late Friday, what we're doing internally is we're having that internal discussion, and then we're bringing in our legal counsels, which everyone watching understands that legal counsels typically make things go really fast. I'm joking. They don't. They slow things down a little bit, but they make sure we get it right. So we have legal counsels look at it, and then if it needs to be elevated, we then bring it to the DCEO at the state. From enforcement aspect, there's a host of things we could do that, quite honestly, we don't want to get to. We could pull permits. We could pull licenses. We could do a host of things. We don't want to get there. And I know those employers don't want to get there. Some, quite honestly, I would say the vast majority of those who aren't following it, I tend to believe that maybe they just don't truly understand the executive order because it just came out. And I think some of that is incumbent on us to do a better job of explaining what it means and what it doesn't mean. And for us to have a better understanding, we need to work up through those proper channels, not just DCO, but also through the governor's office directly.
How are you communicating that to those businesses that aren't following the rules? Are you just calling them or sending them
So
letters?
right now, we've definitely called a couple of businesses before we've sent the letters. The letters would take days, obviously. So many of them, I mean.
Letters come from legal?
I think actually the letters have come from legal, but so I mean many of them are, you know them. You know the individual. You either have their number or can quickly get it. So we handle it that way. And those that we've called, we've had really good interactions with, and they've been very positive. And like I said, I think most of them, just quite honestly, didn't have enough time to really truly understand the executive order that came down.
I have a question for Chairman Haney. Frank, in all seriousness, and I don't mean to suggest that the county's not doing everything it can or should, but this seems like a heck of a time to be living in a county that does not have a full-time executive. Is there anything that is a little harder for you to do or takes a little more time because you don't have the powers you did a year ago?
Sure. Well, you know, what I would say is, to be blunt, the question for those that maybe couldn't hear it was, did the previous issues with the county, the changes to the job of chairman over the last couple years, affect at any point preparation around this issue? I would say that yes, at the beginning, there would be some things internally that would probably happen a little bit sequentially different. We're attempting, like everybody is attempting, to work together because there is something more important to focus on. The idea that we're putting as much aside as we possibly can to focus on the issue at hand. What's the issue at hand is making sure that we're protecting the safety of our citizens, of our employees, and that we're a good partner to folks like the Health Department, the City of Rockford, and everybody at the EOC. What I will say is everything is harder from my perspective, but more importantly, we're doing everything we possibly can to work through this at this time.
Can I just add a comment?
Yes, sir.
So this isn't my place, so I probably shouldn't talk. But what I would say is I don't want anyone walking away having the impression that the chairman's not working full-time on this issue. There's few people who have brought the same type of energy and advocacy than the chairman has to this issue. And I, for one, am getting constant communication from the chairman, and I probably am, outside of his wife Leslie, probably the second happiest person that his wife took his phone away from him last night. He's working incredibly hard on behalf of all the residents of Winnebago County.
And I guess as a county, kind of an independent that oversees, you know, health for both the city and the county, I've really not seen any slow up. I mean, we really have moved through, even the attorneys, and we'll give them they have worked as a team, and when appropriate, reached out to other municipal attorneys, right? Because we're talking about, you know, an order and making decisions that are going to affect regions, and why can it happen here and not here, and state and national chains, all of that kind of. So, I mean, I have seen really, when things need to get done and you say this is an important issue, we got to make a decision and move on it, everyone has been able to move on it really with lightning speed.
I have a question for either Dr. Martell or Mayor McNamara. I'm not sure who is better fit to answer this, but Mercy Health just issued a temporary furlough for certain personnel. They released it to us about a little bit after 3:30, so I'm not sure if any of you were aware before this. It doesn't exactly go for direct contact. Let me just make sure I quote it correctly. So it's for employee partners who are not providing direct patient care or for services that can be delayed. I just want to know if this was kind of an anticipated step that might have been taken, and if there's any cause for concern with this. I think, especially at this point, we'll be public any time that, you know, any medical professionals, whether or not direct contact with people involved in coronavirus or not, I think it could lead to some potential, you know, unrest.
Each system, we heard it through the incident command, and they really vetted it through the other health system partners as well, and said, we feel that this is the best steps that we can take to ensure that our hospitals prepare, provider and our workforce are ready for the next phase. And I think that that is an important discussion. The health systems are all looking at how, within their institutional settings, so within their parent organizations and their region, how do they best achieve that? Mercy was, you know, very upfront about their decision. They were going, and we knew that they were taking that. And again, with the idea that they are trying to really make sure that they do not have non-essential individuals. But I want everyone to know that the term non-essential, I don't want anyone to think that they're not valued, that they're not important to our functioning, but in the classification that they're using, that for their everyday operations, they really want to focus on making sure that they have an adequate number of healthcare providers in their system to be able to care for individuals.
I would say that also does so highlight the importance of the federal government getting a bipartisan stimulus package through. In the packages that they're discussing right now, there's dollars in there for health systems. And it's so critical because we're asking our health systems to work overtime, but they're also working overtime on a number of items that isn't typically their revenue streams or their largest source of revenue, which is those elective procedures, the physical therapies, and other items that they typically have been doing. So we're cutting off some of that so that they can serve more public health overall. So we need that federal government stimulus to come in and really help out our health system so that they can continue to be strong right here in Rockford.
I think both.
There's two more questions.
All right, I think this is kind of just a really quick follow-up. I think you both kind of allude to it already. Does this concern either of you?
Well, I would say first and foremost, anytime any person who calls our county home loses their job, absolutely it concerns us. The amount of stress and pressure that adds to that household is incredible. So yes, I think I can speak for all of us that it absolutely concerns us. I think that's one of the things that makes this pandemic that we're in so unique, is that we all know, and everyone watching this knows someone who's either lost their job, had their hours cut way back, and are really trying to figure out what they're going to be doing to pay their bills, put food on the table. And I think that's one of the wonderful things that we've seen throughout our county, is that there's residents who still do have those positions and jobs stepping up and going above and beyond. When you see the United Way creating their fund to help individuals in need, when you see the school district and a host of other community organizations come forward and say, we want to feed those kids in our community that are 2 to 18, you're seeing a tremendous philanthropy, you're seeing tremendous good work being done throughout our county. But yes, I mean, that's the stuff that keeps you up at night.
Following up on that job losses, have you or Chairman Haney received any, typically when there's large-scale layoffs, you get a warn letter, or notice like that from an employer. Have you received any such letter, or do you know of any other confirmed large layoffs because the.
So, Isaac, you're asking if we received a warn letter just for folks at home, if they, which we typically will if there's a large layoff. I know I have spoken to individuals over at Mercy, so I did know that was coming. Other than that, I have not received a warn letter that I can recall from any other large employer or medium-sized employer in our area that I'm aware of. It may have went directly to our legal, but if we did, we'll certainly report that out.
Is this action anticipated for either of the other two providers in the area?
I haven't had, I would say Mercy was very open in their discussions with us. I have not had any communications from either OSF or Swedish American that furloughs would be coming. I would say, with that being said, all employers right now are under tremendous strain. So I don't want to say that'll never happen. I don't think any of us up here have been made aware of any decisions made.
Going back to local companies and organizations stepping up, the governor had called on manufacturers to help create personal protective equipment. Have any local companies started to answer that call?
Yeah, you can go for it if you would like.
They did too. So around PPE, so locally you have Supply Corps working with our Emergency Operations Center, our logistics team in the Emergency Operations Center. You have a local vendor to the county who works with our nursing home also pitching in. The mayor may jump in, but there's a number of local examples. A local distillery is helping with hand sanitizer. They're popping up every day. And as I mentioned at the beginning of the press briefing, the Rockford Area Economic Development Council has made a call to all local businesses to the degree they're possible to help with a number of PPE related items. That's it. Thank you. Thanks, everybody.
Thank you.